Well, hello. I hope everybody's having a great day. Today is Tuesday. What time is it? It's about wow. It's already almost 1:30 here on July the 3rd. I hope everyone, if you went out of town or tomorrow go see some fireworks, hope you guys have a safe and really nice 4th of July holiday. Hopefully, you get a chance to spend it with your family, friends, significant other, dog, cat, whoever. But in any event, I just had a meeting first with Jenny and then with Shlobila. You know, if you remember, we kind of cut our class in half, going, I think it was A through H is Jenny, I believe, and I through Y would be Shlobila. So what we wanted to do is, again, just fair warning. As I've been saying in the last few discussion questions, about the first few discussion questions, we did the baby steps idea where we would give you feedback on constructive criticism on, how to improve your APA format. I think in the first couple things I said we would wait till DQ 3 or 4, then really start grading them like real. I know that this week Jenny just kind of took a fraction of a point off, like 0.1 or 0.2. I think there was maybe one other student that had a couple of different things that were going on, but just a very small amount. But as we go on, we're going to start grading it like it would be on campus normal grades. So if you got feedback this week about saying, do this with the running head or do this with your citations or your references or blah, 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 please implement whatever they are suggesting, because going forward, as each week goes on, we're going to really get to just grading them like the way they should be graded, because by now everyone should have had a fair opportunity to digest the constructive criticism on how they improved the APA format. If you guys have had me in prior classes, it's probably not a big deal to those students, but it really does make a difference because some professors are very, very tough on APA errors. I remember when I was going to school, the professors at the University of Maryland, well, this was PhD level, but if you turned in a paper with 2 or 3 APA errors, they wouldn't even grade it. They'd give it back to you and it was going to be late, and it was really a pain in the butt. But, we're not going to be crazy like that, but we want to get everyone up to par, so to speak. Okay, that's the DQs. And the quizzes, everybody's been doing fine on them, no problems. You've gotten your grades. They've been, graded in a timely manner, so should be no problem. Now, the interview paper. Now, I don't know if you remember from last week. Originally, it was in 2 or 3 places. It said June 24th. There was one place on the outline where it said 7-2. So thus, since there was one place that we forgot to update, I forgot, it's on me. I gave until July the 2nd to get all those in. And it looks like we have, let me just pull it up real quick. I think we have most of them right now. Let me just, okay, interview paper. Yep, so good. So we're good to go. All of them have been submitted. So then we are going to be starting grading those now because we wanted to wait until everyone got it in. So over the next few days, those should be popping up. Certainly by next week, that will be graded. Then the next thing on tap is going to be let me just pull it up real quick. Yeah, the disability experiment. Now this is interesting because some of us are spread, as you know from your DQs, and hopefully you put up your student profile. Some of us are all different places. We've got students in Kenya, here, there, everywhere. So it might be more difficult for some to accomplish this disability experiment, but really the whole purpose of doing this is to, in a way, for just 2 or 3 hours, give you a sense of what it would be like to have a disability. Now, some people in this class have disabilities, so you don't have to pretend you know what it's like. But for some people that, they've never experienced anything like that. I mean, in my personal life, I've had a shattered calcaneus, I've had some knee surgeries. So I've been out of commission for a while where, I can't get around, so I could kind of get a little snapshot. But getting back to the disability experiment, I remember, when I was a grad student and I was treated so differently because I was in a wheelchair, it really made an impression on me. I'm hoping that, well, first of all, I hope you're not going to be treated badly, but You might even go places like, for me, I went to the local mall and to a place called Ruby Tuesdays. It's like nothing fancy, a restaurant, salad bar, that type of deal. And once they saw me, usually the greeting would be, "Hey Scott, how you doing? You want to get a salad bar? Do you want, Coke or beer or whatever?" When I came in the wheelchair, they stuck me all the way in the back, away from everyone. It was like I was ostracized. And I was like, wow. And even just going through the mall, some people want to help you, some people look at you weird, and some people kind of look away at you. I mean, it's really fascinating, the experiences that at least I had in my master's program when I did this, and that's why I put the disability experiment up on this class. So coming back to the due date, so that's going to be due July 15th. So, it's around the corner. Like I preached for the medical interview paper, don't put it off till last second, because things can happen. Maybe you show up at the mall and they just gave out the last wheelchair and you're out of luck. I would try to do at least a week ahead of time, if not earlier. We've got right now, today's the 3rd, so we got roughly 12 days. So I would get on this pretty sooner rather than later, I guess is what I'm saying. And then once you write the paper, the problem will be you'll just want to keep going on and on and on and on and on, because I think you'll have some interesting experiences. But if for some reason, maybe your geographic location or there might be other variables where this is going to be difficult, contact me and CC the teacher's assistant, and we'll come up with a plan B. I think I did that with 1 or 2 students. But I think it will be an eye-opening experience for some of you. So what else do we got? After that, once we knock out, because you've done the interview paper, every week we've got a quiz and a DQ, so that's that. Disability experiment, once that is done, we're halfway done, really, because we've got the case study due August the 1st, and then the big research paper due August the 20th. If it was me, I might even start working on one or both early, so that there's not a big crunch at the end of August to get all this stuff in, especially if you're in another class. And that's something else. I know that I've been hearing from some students that have been like in a condensed class this summer that was really quite challenging for them. And I'm trying to be cool about, giving you a little extra time if you need it. I've been a student, I know how it is. So if there's something going on in your life, my best friend's getting married, my dog is sick, who knows? Let me know and we'll work with you. So we went over the things on the horizon. Let's talk about the chapters then. So chapter 18, if you're in this book, and it would be, let me pull up the other one because we got 2 different things going on here. Let me pull this up. Give me 1 second. Go to the outline. We'll have it for both. Okay, so for today, in this book, the older edition, it's 18, 25, and 26. So chapter 18, psychiatric disabilities. I'm actually doing a lot of work with individuals diagnosed with all different kinds of psychological and psychiatric issues. I think this chapter probably it depends, what kind of clientele you're going to be working with, where you're going to be working, all that kind of stuff. But I think that you will be coming in contact with a number of individuals with psychological or psychiatric problems. We know that the Diagnostic Statistical Manual of Mental Disorders, known as the DSM, that's kind of like the gold standard that we use all the time to classify and define said conditions. Gets into prevalence, obviously, of how frequent these things are. Look for a few moments, if you're not familiar with it, with the axes. It's a multi-axial assessment format of the DSM. Axis number 1, that's really where the main thing is what is the clinical disorder? What are the conditions that we're probably going to have to be dealing with? Axis 2 is personality disorders. I mean, those are things that really we have limited amount of ability to modify. Hopefully Axis 1 will have a little bit more input there. Axis 3, general medical conditions. Maybe the person also has a back injury or PTSD, or they had a traumatic brain injury, or who knows what. Axis 4 is psychosocial and environmental problems. I know in my evaluations I go through, let's say the one I'm working on today. I'm working on a case, a guy's 20 years old, had a lot of trauma in his life, starting with dad going to prison, mom getting beat up repeatedly by her boyfriends, As the 5-year-old kid tried to intervene between one of the fights between the boyfriend and the mom, got beat up. On top of that, got lead paint exposure. So as a kid was eating lead paint, and it cognitively caused brain damage, as well as academic and behavioral problems and all kinds of stuff. So now I'm coming in the picture when he's 20 and eventually trying to develop a rehabilitation plan. In this case, I'm thinking of CDL truck driving for the guy because, one thing I always do is I look at the labor market. On top of my data points, my IQ testing that I've done, my personality testing that I've done, review the medical and psychological and psychiatric file, my clinical interview, their education, their background, their genogram of their family structure, all the pieces of the puzzle come together. And really the axis 1 through 5 is this is where you'll get information from the psychologist or psychiatrist that will really be, like for me, usually when I work with these cases, I'll get like 1,000, 2,000, 3,000 pages of stuff, and my reports are usually 25 to 50 pages. So I really spend a lot of time going through everything from the day they're born to the day I meet them and getting all the stuff. And usually what I'll do is they'll have 2 neuropsychological evaluations, one from the plaintiff, one from the defense. They'll have different, diagnosis on the DSM. The axis will be different. But I put both of those in my report. So when I'm sitting here looking at these, like, oh yeah, I read a whole bunch of these reports yesterday about this. So look at, kind of coming back to our book now, look at the multi-axis assessment format of DSM. And then, the DSM basically gives certain disorders or conditions, like you'll need to meet a certain number of these symptoms to be diagnosed with said condition. But one of the cool things is about the global assessment of functioning. If you could see this chart, maybe it's kind of hard to see, but it's in your book. These, I would kind of look at the top in these categories. So, because a lot of the people I'm dealing with are like in 30 to 40, 40 to 50, 50 to 60, where they're having different kind of difficulties either in school, social functioning, maybe judgment, thinking. Who knows? The lower the number, the worse off the condition is, essentially, is the simplest way to think about it. Think about like your grade. So if you're 91 to 100, then you really would have no symptoms and really no impairment. 80s, you're doing good. There might be a couple little things. 70s, 60s, 50s, and so on. And, more and more issues happen. So do pay attention to that chart. Then they get into like different conditions like schizophrenia, the phases, the types, the impairments. We'll get into mood disorders. I don't see many with schizophrenia. I see a lot of mood disorders, of course, bipolar, major depressive disorder, anxiety, PTSD. I see a ton of all that, especially PTSD in my work with veterans. Panic disorder, generalized anxiety, all that kind of stuff. So read through that. It's really good information. Then we get into barriers, because many times it's not really, it's really a combination or interaction between the individual and then the barriers they experience in society or at work or at school or whatever. So do spend some time going through the barriers, the social and vocational functioning, and then we have our cool case study at the end. So that is that chapter. And let me go to chapter, next one. And I hope you enjoy the book. Like we talked about in the past, it's not meant to be turning into a neurosurgeon, but just to give you some general knowledge about all these different conditions that we're covering. So in the old book, it's called MR, which I hate that term. In the new book, it should be cognitive impairment. Let's see what they call it in the new book. Yeah, intellectual developmental disorders, cognitive impairment. Those are more of the politically correct way to talk about that. But essentially what they're going to do is they're going to go through, individuals that have low IQ and the causes and etiology and the prevalence. A lot of it is going to be prenatal. Some of it can be postnatal, meaning, after birth. There's a lot of information in there. Look at the functional limitations, because like the case I'm working on now, for example, when I tested the guy's IQ is at 81. The defense neuropsychologist, it was 80. For the plaintiff's neuropsychologist, it was 75. So what I'm getting at here is I try to triangulate different data points so we get a better picture or a holistic picture of what's going on with this individual. And of course, we get into like functional limitations, the environment, the rehab potential. Supportive employment is not really as popular as it used to be for various reasons. They go through the different characteristics and kind of models like place and train and stuff like that. So do take a look at that. And let's go to the next chapter. Now, learning disabilities, again, you see, at least I see a ton of these. And there's really two kinds of persons or individuals. One that might be older, say like 40s, 50s, 60s, and they never were diagnosed with learning disability. But when I meet with them and I do testing with the wide range achievement test, among others, I can see usually if it's more than 1 or 2 standard deviations from their other scores, something's going on here. And then we would do more in-depth examination about learning disability. Now fast forward, say the person's 15, 20, 25, 30, then the school systems would have been doing a lot more testing and probably would have picked up a learning disability a lot earlier. But for the older population, they probably either quit school or kind of just made it through school, and some of the subjects they hated. Usually this is how it plays out. Mr. Smith, I see that your mathematics scores are quite low, but your reading and your other ones, sense comprehension, everything's fine. Tell me about school. Did you like math? Oh my God, I hated math. I was always falling behind. I could never keep up with the students. I don't know what it was. And usually after them talking about it, the next thing they'll talk about is, that's why I went into, occupation X, because I hated math and blah, blah, blah. So depending on the age of your consumer, client, or evaluee, depending on what kind of case and symptom and essentially agency or where they're getting services from, they're going to have different names. They're going to be different times that it's either picked up or not picked up, and how did they essentially work around it is the simplest way to think about it. So coming back to the learning disabilities chapter, it follows the same model. So we're going to have the intro, you're going to have the prevalence, defining learning disabilities. Now that's actually pretty important because the definition of certain conditions determines if you get treatment or services or if you don't. So that's kind of important. So please pay attention to that. They go through diagnosis and evaluation, how you do an assessment on it, the characteristics. Is it learning characteristics? Is it medical characteristics? Is it more social skills? Is it job-related stuff? Then we'll get into reasonable accommodations. That's what we do for a living, is we try to come up with accommodations. We put on our rehab counseling hat and try to figure out how we can help this individual with whatever condition they have, maximize the quality of their life, and I would take it a step further and say the economic independence of their life. Because in our society, you got to pay your bills or you have a problem. Then we get into like the rehab potential, all the different types of accommodations and interventions like assistive technology that we can use. And sometimes it's as simple as, you need to dress differently. You need to get, say like the construction worker that's used to wearing AC/DC shirt and ripped up jeans. Now, say you got a back injury, you got to work in an office, that doesn't fly. You're going to have to change, the way that you perhaps behave at work, even the attire for work, all that kind of stuff. So it's going to really depend on, what type, going back to that chart about the numbers, are they 40s, 50s, 60s, 70s, 80s, depending on the severity of, say, condition, that's what we're going to have to deal with. And then the case study at the end, and then the chapter. So again, usually kind of short and sweet, not driving you crazy with a lot of medical stuff that's over our heads that you probably will never really use because you're not going to be diagnosing people or doing surgery or anything like that. But I really do hope that you're enjoying our class so far. I know for some of the students that were in the condensed class, it's been a challenging summer. Again, if you need a little extra time, the key is ask me ahead of time. That's what's really important. Don't wait the day that it's due, or God forbid the day after the assignment's due, to ask for extra time. And we're trying to think if we covered everything. We talked about the quizzes and DQs. We talked about the interview paper. We talked about the case study, the research. I think we covered all the bases. So I hope everyone has a great 4th of July with your family and friends, and have a hot dog, have a beer, enjoy the fireworks, do whatever. And probably what we'll do is next week I'll ask for some informal student feedback. Meaning, you always complete the student evals at the end of the semester, but I like to kind of check in with my students midway to see how class is going. You know, I'm human. Can I do something better? You know, so that's going to be totally voluntary. So we'll probably send out an email maybe over the next few days or over the weekend or something like that, or maybe early next week, just asking you for some feedback. You know, how do you like our class so far? That type of stuff. I know I certainly heard from the students the 1 week I was not able to do a video lecture, so hopefully you find these helpful and there are, you know, some utility to it. But in a nutshell, I'm really pleased with the work everyone's doing, and I really do hope you enjoy our course and working with me and the teachers' assistants that we have. And I was just praising them and thanking them for their time and helping you guys out with APA issues and that kind of stuff. So without any further ado, I hope everyone has a great week. If you need something, please let us know. Otherwise, I'll see you next time.